Hi, and welcome to Supercharge Your Health. I'm Suzanne with Discount Med Direct, and you can reach me at 941-421-7155, or our website is discountmeddirect.com. And don't forget to like, share, subscribe to the videos, the podcasts, whatever you listen to. We are on iHeart for podcasts, or Apple Podcasts, or wherever you get your podcasts.
Wherever you get your podcast, and really like us and subscribe to our channel. This is Supercharge Your Health. I am Beth Annie Stockdale. We're here at your Total Body Wellness Center in Florida. What we're doing here with Supercharge Your Health is just expanding your horizons, teaching you and exposing you to all those different holistic, alternative, ancient, new modalities. And
options.
Really, that just, to get your body to its optimal health in ways that you may not have even thought about or explored or just curious about or had questions about. And I am, again, so excited. I know.
She's the excited one.
I'm the excited one. I say this every week because we've just been having some great guests. And today's no exception.
Thank you.
This is Dr. Let me get it. Irena
That's right.
Romansky. Doctor, we're going to call you Dr. E.
Everybody calls me Dr. E.
Great. From over at Twin Palms Chiropractic. She's a chiropractor here in Venice. And instead of me bumbling through it, I'm just going to go and turn it over to you. Tell us a little bit about yourself. Okay. And then let's talk about chiropractic care.
Of course. I've been here in the Venice area since the mid-'80s. So I've been here for quite some time. Raised my 5 kids here. Been practicing here for all that time. Yep.
Oh, wow.
I'm kind of like a chiropractic dinosaur.
You know, a dinosaur.
Well, thank you. I've been with Twin Palms since 2007, so I've been with Dr. Dan and the practice there for quite some time as well.
Wow. That's great.
Yep.
All right, so let's just pretend like we're talking to someone who has no idea what chiropractic is.
Okay. It's actually surprising because there are still quite a few people out there who do not know what chiropractic is, or they're unaware, or perhaps they're misinformed. So, in a nutshell, what we do is really quite simple. Patients come to see us for a variety of problems, ailments, maladies, and we'll get into that in a little bit. But really, chiropractic is all about maintaining and correcting problems that happen within the spinal column. We can also encompass other extremities as far as doing adjustments, making corrections and alignments in those areas as well. And the reason it's so valuable is that when there is a problem with the spine, when something's a little bit out of alignment, the spine houses the entire nervous system, which is our grand central communication system of the entire human body. So should there be a problem in the spine, and this is sort of a quick synopsis, it can impede that nerve's transmission. So whatever happens in the human body has to be communicated through that nervous system. And if you interrupt that, if you occlude that, if you damage that, it's going to affect a person's health in some way, shape, or form. A simple example, a very simple example, would be people who come in quite often with, let's say, sciatic pain. And that's the nerve that runs all the way down the back of the leg, as well as other places.
Now, I'm going to ask you to keep your volume up of your voice,
okay.
too. You're very soft-spoken, and I'm like, trouble hearing me. So, yeah, if you can just keep your volume up.
Okay, keep the volume up.
You're drifting off.
So we were talking a little bit about sciatic nerve pain. So something usually in the lower part of the back comes somewhat out of alignment. It puts some pressure upon that nerve. The nerve becomes irritated and inflamed. And that's where people will come and say, oh my God, I don't know what I did, but I've got this pain running down my leg. So in making a correction to the spine at that level, we're looking to reduce the pressure on the nerve root. Nerve root starts to behave a lot more appropriately. Lo and behold, the pain starts to dissipate.
Well,
start to get better.
A lot of times I know from the couple times I've had sciatica pain, it's not necessarily that you've done something strenuous.
Correct.
I know the first time I had it, all I did was bend over to pick up a pencil off the floor. Not even a book or a pencil, and you just, something snapped. And
and that's the thing, and I talk to patients about this all the time, is that you've come in here with something you thought you just did a day or two ago. It was that one action.
Right.
And I usually equate it to the proverbial straw that broke the camel's back. Because many times there's an underlying problem. You may have a whole history Oh, let's see, I was a cheerleader when I was in high school. Oh yeah, we took lots of tumbles and bumps and scrapes and bruises. Or, perhaps you've had one or two little fender benders along the way, or perhaps you have a predisposition.
Well,
to
in my
things.
case, scoliosis.
There you go, yeah.
Which is a curvature of the spine for people who don't know.
Exactly, exactly. And so there can be things going on that do not necessarily cause pain. Because when I talked about that nervous system, that superhighway, 95% of those nerves directly along the line of the spine are not carrying messages of pain per se. They're really there carrying messages on how to run the body. How is my heart going to beat? How am I going to digest what I had for breakfast this morning? They're running everything that you never even have to think about.
Depending on where they are on the spine, is
not
where
necessarily. Not necessarily. I mean,
Okay.
you can have, let's just say, within an area of the spine, there could be a nerve that is exiting that particular region that's
Okay.
running excretory function or digestive function or trying to get messages to your internal organs or your reproductive function, for example.
Okay.
There's also within the same area those nerves that are coming out of the back, into the buttocks, down the legs, right down to your toes.
Seriously.
Absolutely. So that's
Oh,
why
wow.
many, many times somebody might come to me for something like sciatic pain, since that's where we started with this conversation, and they'll say, "Hey, Dr. E, I don't know if this is related or not, but like since you started adjusting me, I don't have to get up and go to the bathroom as many times in the night." Other functions that start to behave better, more appropriately.
Okay, so
Yeah.
this is a really good segue because you mentioned the digestive system.
Mm-hmm.
Thinking that most folks come to see you because they have a backache or a pain.
Mm-hmm.
What are those other conditions that I may be experiencing that is really my body being out of alignment?
Correct.
What are those other things that
Well-
people wouldn't even have thought of?
I'm going to give you a little bit of philosophy on that.
Okay, go for it.
So if everything that happens in the body has to happen through a nerve impulse or a nerve synapse, let's just say, and everything gets related or interrelated in the brain. So for our purposes today, think about it this way. Everything in the human body happens from above down and from the inside out. So if you impede function or communication at any level, think about any number of things that could be affected.
Okay.
Let's say that somebody tends to have neck pain, for example.
That was me in law school. I think I mentioned that to you.
It's very, very common.
Yep.
And you might have something like, I'm having just a little bit of neck pain, maybe I need to get that adjusted. Or perhaps it starts to run down your arm. But what if it's also affecting a dorsal nerve root ganglia that happens to control how your heart's beating at the moment? I mean, everything is interconnected. So for me to say these are the conditions that respond to chiropractic care, there's no limit. There's no limit.
Okay, so if I'm severely constipated.
So let's think about our sacral plexus of nerves. There's a whole lot going on down there. And it's not uncommon for people to get constipated because nothing's working correctly, including their gut, which, we all know. You want a healthy life, you got to have a healthy gut.
Right, the microbiome.
Which is a whole nother show.
Right, exactly.
But, somebody, and that's...
But it's all connected, and that's why I love chiropractic. I can't think of doing anything else with my life that has more value, because you touch upon things sometimes when you adjust people that you don't realize you've touched upon.
Right.
Absolutely. Right. They may have come in for one condition, like some of the common conditions that we hear about: headache, neckache, backache, sciatic pain. But there's so much more than that happens in a chiropractic office, and many times I am almost as surprised as that patient. The days I think I've seen everything, and I've been in chiropractic a long time, and a patient will come in and say to me, I can't, I got to tell you what responded. I'm like, well, shut my mouth. What do you know? And I'm the one who's supposed to be saying, hey, see me for this. And say,
right.
You have to understand the human body is a self-healing organism.
Yes.
And we probably do not give it enough credit on that level. That if you do the right things, if you take care of yourself, if you put the right stones in place, that path will be there for the body to heal. That's the way God made us. That's the way we're designed.
See, and that's like the theme of what we're about.
Mm-hmm.
Is not relying anymore on going and getting a pill, and this is going to make you feel better. and this is going to correct what's out of alignment. Whereas once we get balanced,
Yeah. I mean, there is
we're
a time and a
hydrated.
place for everything, including medicine.
Well, yeah, and
Well,
we're not-
absolutely.
if I get hit by a bus, I need a doctor to realign the bones that whatever.
and we are not anti-medical
not
professionals in any way, shape, or form. We've had
No.
nurse practitioners and doctors and
Right.
everything in here, so we're not. And in fact, we've talked about hormones and going to a doctor that will give you the right hormones and do all those things to get your body back in
To
balance.
get the body back in balance.
So like,
even-
like any level of healthcare, what I do, I try to be minimalistic. I want to create the most appropriate adjustment in that moment. Just as if you're, whatever you're practicing, too much of a good thing is not necessarily a good thing for the human
No.
body. And as you
Nope.
said a minute ago, it's all about balance.
It really is. And alignment.
Absolutely. Absolutely.
And I was joking, well, not really, about the constipation.
Yeah.
But if you're constipated, you're tightening up
On all levels.
on all levels.
Yeah.
You're deep, and I just spoke to a group, and this is where this interconnectedness all comes along. All right, everybody listen up. It's summer, it's hot. You guys are getting dehydrated, you're not drinking enough. You get dehydrated, you get constipated. Right?
Absolutely.
Because your body's drawing the fluid from your food, and and you're getting all constipated, which is making your muscles tight, which you're going to do those movements. They're going to throw you out of whack. But in the meantime, you're getting a headache because you're dehydrated.
And your chemistry's off.
And your chemistry's off. So let's look. Here's your symptoms, but the root causes are you're not drinking enough. Right? You're
And
not
we're
hydrated.
talking about water.
Yeah,
Because some people are drinking plenty.
Just got the right thing.
which is dehydrating you, right? But then you can go and get aligned, right? Which is what your body needs. Now, my personal experience with chiropractic is, and this is what I was told by another chiropractor, I got x-rays done, is I don't have enough curvature in my neck.
Curve in your neck, not
Right.
curvature.
Curvature, sorry. I know, good. Thank you for correcting me. And so, like, my head sits on top of my neck a little precariously, and I tend to get tight
Absolutely.
here, which pulls my head off this way.
Forward head carriage.
Right. And then I get headaches like you would not believe. Now, this was when I was in law school. This was really, really, really bad because I'm at a computer. So we're going to talk to, who can use you. If you're at a computer and you're doing the rounded shoulder thing and your head is down, what is that doing to your neck?
It's bringing everything into forward head carriage.
And so explain a little bit
Well,
about
and here's
that.
something interesting. Now we are in a pandemic right now, and many of our essential workers are doing their work from home. Right? They're Zooming. They're having to do online teaching or distance learning. So quite a few of my regular patients have had to change their adjustment schedule. They're not used to working at home. They're not used to being in front of that computer, and they are having just this exacerbation of symptoms because of that posturing of the body. And you know as well as anybody, you get like this, a body needs to be open.
Yep.
It's got to be
Part-
open back up again. Part of that will be the adjustment, of course, to realign things.
Right.
But some of it too is that recognizing that change in your situation, in your circumstance, making corrections there, and getting out, and you're going to have to do your yoga at home, or you're going to have to find some way to open that body back up again.
And I noticed it when I was working from home, and I only did it for a month, that at work I have a desk that's the right height, my computer is the right height,
There
my
you
chair
go.
is the right height, but at home I don't have that.
Yeah.
My desk was the wrong height, my chair was the wrong height, and I tried different ones, and my computer I was using a laptop instead of my desktop, and it I could
absolutely.
feel it. I definitely could feel it in my shoulders and my back. And I think it was actually Dr. Dan at your practice that told me that actually sitting at a desk working is worse for your spine than being like a physical laborer.
Correct. Yeah, I would wholeheartedly agree.
Yeah, because the physical labor people, yes, although they're beating up their bodies, they're moving them.
I would
And
say
sitting at that like that at that desk for hours and hours a day is really bad.
it's tough. Yeah, I always say, that in my opinion, especially because we see such an older base group of people. Not that we don't adjust all ages, but I tell people the two most important things as far as your spine is concerned: mobility and stability. You lose one or the other, or God forbid both, and you will be chasing health forever.
Oh yeah.
Forever.
Oh yeah. And getting back with the whole sitting at the computer thing, back not that long ago when I worked in the office when I was an attorney, they specifically did that whole ergonomic thing, that the monitor was at your eye level, your arms, your hands were at this level, your feet were flat on the floor, you were at right angles here, everything was ergonomic. And then we got laptops, right? And then we got phones. And it's like for the last 20 years, our vision is going down.
I have the opposite problem at my office right now. One of the girls wanted one of those stand-up things.
Cool.
And I'm like, so we got her one, and no problem. Well, it sits this, 2 feet up or 18 inches up off the desk. Well, for me, because I'm very short in the body, that's too high for me. So when I sit at that desk, I'm looking with my head up, which, at least it's stretching it out from sitting at the other desk. But I have a hard time sitting at that desk for very long, which it's not my desk, so I'm usually there for a few seconds.
But you can understand.
But I totally am like, but it's the opposite. It's not the forward down, it's the up and back.
You're going to have to adjust that. Yeah.
Well, I don't use that desk other than occasionally when I run over there to find something. But it works for them. They're happy with it. So
So when somebody comes to your office, what kind of techniques do you use? Do you use instruments? Can you explain? So someone who's never had a chiropractic adjustment,
or even a chiropractic visit. I mean, your chiropractor is going to do. They're going to do a complete exam and evaluation. Okay. I want to hear who you are. I want to know what you've been through. I want some of your history. Not just here's why I'm here. What do you do for a living? What does your day look like? How are you using your body?
How are you sitting at a desk?
How are you sitting at it? Yeah, absolutely. And many times people are already retired. I'll say, well, what kind of work did you do when you worked? And they look at me like, what? Why does that matter? It does matter.
It does matter.
And so your chiropractor will do a complete and thorough examination. They're going to do orthopedic testing. They're going to do some neurological testing. A lot of it is the history. You've got to find out exactly what you have sitting in front of you in that moment.
Okay.
At that point, he or she may determine whether or not x-rays are going to be appropriate and might recommend them. I want to see a picture of that spine from the inside out.
Dr. Dan Neumann always says you don't know unless you look.
X-rays always tell the story.
Right.
It's like opening a package, because if there's been trauma that you may not even remember. I see it all the time. I'm like, wow, what did you do here? Did you hurt yourself? How did you injure this? Well, I didn't injure that. I'm like, well, yeah, it's here. You injured this.
You did.
And the interesting thing to me is that that patient will tell me a week, 2, sometimes 3 weeks later, I remember what I did. And it wasn't a small thing. Like, it's something that you definitely would have remembered. Like, I don't know how I forgot that. Yeah, I got hit by a Mack truck. Things like that.
But my dad fell when he was probably in his late 30s. Slipped on the ice. We lived up north. He slipped on the ice and fell, and had, later in life, issues with his back. And I think he even went in and saw Dr. Dan, and he said, yeah, it's probably
right
from
here.
that, when years ago when you fell. And my dad didn't remember doing it, but for some reason it stuck with me.
Well, or God forbid there's instability or pathology in there. And you're going to come in there and make an adjustment to that patient, and perhaps you didn't think that x-ray was necessary. Well, that x-ray was necessary.
Yeah.
So it is on an individual, base as far as what the patient's telling you. How old are you? What's your life history? But I do like x-rays. I like seeing what that spine looks like before I put my hands on somebody.
Oh, absolutely.
I don't make it mandatory. At that point, I'm listening to the patient, and many times I will ask them, do you have a preference for how you are adjusted, or have you been adjusted by a chiropractor?
Okay.
So let's say they've already been under care. What's your preference? Do you like a hands-on adjustment? Would you prefer an instrument adjustment? Do you like something very conservative? Sometimes they'll say, nah. I'm like, oh, you like a boom-boom adjustment, I'll say. I call them a boom-boom. I've been out here a long, long time. I don't mix words. I'm not as technical and sophisticated as I was day one, where everything had to be by the book. I want to talk to that patient.
I used to call them thump and bumps.
Thump and bump.
Thump and bump. You got
So I
to
think
roll me over.
Been adjusted by a chiropractor before. I will try to start off a little bit more conservative.
Right.
And even the office staff knows, like, if a patient's really a little bit wary, I'm female, I got a bunch of kids. I'm very empathetic, even as a mom. I'm not going to rush them into a technique they might not be comfortable with.
No.
I am a hands-on adjuster. I do use the activator. I will use other instrumentation or decompression. I'm kind of known as the neck doctor over there. Somehow I've honed.
Good.
Yeah, they're like, I'm having a hard time with my, oh, you guys see Dr. E. If it's a neck, not that there's any absolute. We have 4 great sets of hands at this practice right now, which is really, really nice for me. If I want to take a vacation, I know when I leave, my patients are in good hands.
Well, and I've been a patient of Twin Palms. You walked in and said, I know you. And I've been, I think I've been with Dr. Dan almost since he started. I mean, I was probably in his first 100 patients. I mean, because we talked one time and I'm like, how long have you been doing this? And he's like, I don't know, it was 10 years at the time or something. And I'm like, was I like one of your first patients? He's like, yeah, I think you were. So I've been.
Yeah, I remember you from the old building.
Yeah, I used to go to the old building and been through, I don't know, 5 or 6 renovations at this building.
Oh my God.
So yeah, I've been with you guys for a long time.
It
and
really
nice.
is a treat having a team, and we are a team.
And family too. It's like you're one big old family over there too.
We kind of are.
Yeah.
I've always been that way in chiropractic. My first husband was a chiropractor. We opened a practice together here.
Wow.
My kids would be in and out of the practice. So chiropractic has never been my job. It's always been my life.
I know.
Always.
You're like me. Everybody's like, when are you going to take a day off? I'm like, is there any techniques or things that you do that really make your heart sing that maybe you do differently or you're really passionate about that maybe chiropractic or maybe not?
Because you guys have a lot of stuff over there, not just chiropractic.
And everybody comes from a little bit of a different place. So I do like I said, I really spend a lot of time honing in on a very specific neck adjustment for patients. I also do a extremely specific first cervical technique that not a lot of chiropractors do anymore.
What is a first cervical technique?
So that's your atlas, your very first cervical segment. And remember what I said, that if everything has to translate from the brain unimpeded in order for that nervous impulse or that message to get through, and it's stopped up right here, it can affect
that one really hurts.
It can no, not that one. Not the specific first cervical, because it's almost like a fingertip technique.
Oh, I was going to say,
that's why I say
one right at the top.
Yeah, no. It's one that not a lot of people do. It's really where chiropractic got its start way back when, before people even knew that they could go to a chiropractor. So it's an older technique, but it's an extremely specific technique.
So, I mean, how long has chiropractic been around?
Since 1985.
Oh,
1895.
Thank you.
I was going to say.
That's the one thing that we've been talking about is these modalities may be new to people, but they've been around for hundreds of years.
Yeah, chiropractic's been around for a long time. And, I've been through many years, decades now. I was just a pup when I started, and that was when I was just a baby. What I see happening in chiropractic is that people are looking for the alternative. They're not just looking for a feel-good, make me feel good. They want to make changes. They want to make changes that are going to impact long-term health. And of course, that's not everybody that comes through the door. But it's so rewarding to see people coming in with sort of a different goal. The other thing that has happened over the years that we didn't have when I started was the internet. I mean, we have computers, but so my patient base is much better educated now. So when they get there, they're asking questions. And I think that sometimes people think that is perhaps an annoyance when somebody questions, well, I read this or I thought this. It isn't, because you're starting off from a better platform of information.
I want my folks to be educated.
Yeah.
And when they're asking questions, as long as they're not questioning your authority, that they're not challenging your authority.
Yeah, I mean, I let go of a lot of that over the years. It's not that big a deal to me, because they're going to find out in that room. And I say to them, if I do anything that you are uncomfortable with, I want you to tell me. I'll back right off. We'll talk about it.
Right.
If for some reason this set of hands, you don't think it's the right set of hands for you, we have 3 other very gifted chiropractors in my practice. To me, when somebody's questioning authority, I think that they themselves are just a little bit unsure of, am I in the right place? Like, I've got to make sure that this is the right decision for me. I see it a little differently.
Especially in the beginning.
Yeah.
You know, they're just not sure if this, does it really work?
Well, and I think
get some
chiropractic,
of that,
a lot of
bit of
people have kind of a negative connotation of chiropractic.
Well, it was worse in the 80s.
Yeah, I think it's changing now. But definitely when I started going, and I went to a chiropractor before I moved here, so probably in the 80s or early 90s I started going. But even people that I told then were like, oh, I wouldn't go to a chiropractor. Yeah. And I'm like, what's amazing? You should try it.
Yeah.
You know?
I mean, you're always going to have that. I think that there's always going to be some maybe divisiveness in the healthcare field for whatever reason.
Well, I'm not even talking healthcare field. I'm talking just general population, like friends of mine that I would say.
But that comes from someplace else.
Right.
That comes from someplace else.
Their parents or whatever. So, if you can explain some of the symptoms, because that's what people are going to come to you for. What are some of the symptoms that people may be experiencing that chiropractic can possibly help?
Okay, so in a typical week, let's say, I am going to have low back pain. I'm going to have low back pain and spasm. I'm going to have pain that radiates into the buttocks. I'm going to have pain that maybe goes all the way down the legs. It may or may not encompass the feet. They may have parts of their body that are now numb.
Well, that's what I was going to ask about the...
I'm going to have neck pain. I'm going to have neck pain that, I'm going to have a kink in the neck. I'm going to have pain that goes down the arm. I'm going to have patients who can only sleep in one position. I mean, and that's musculoskeletal. That's the stuff we think about all the time.
Right.
That's a small part of anything that I might see on a day-to-day basis.
How about any neuropathies?
Always.
Okay.
We always see them. And we see kids. Kids, you think they're made of rubber. They're not always made of rubber. I actually adjust animals periodically. I took some courses, and because, if you have an animal where they have a misalignment, that nerve is impeded, and you'll know how they're walking, how they're moving, and they respond so much better than we do.
That's very cool.
I have a question now. How early did you adjust your own kids? Because my chiropractor up north, he adjusted his kids as soon as they were born. Because he said natural birth.
Well, if we have a minute, I want to tell you a story. Though,
okay,
since you brought it up. So, my kids were all adjusted pretty much right away or pretty quick after birth. But one of my kids, and I had some of my children at home because I kind of function in that venue.
There you go.
My daughter, when I was pregnant with my daughter, she was in a posterior leg. And so the midwives had said, well, it's kind of a tough way to deliver a baby. That's where the baby's face is up instead of face down.
Got it.
And they got that baby to turn, and we went through some different movements. And when I was in labor, and this was my third child, so you kind of know what's coming along. And when I birthed the head, any mother knows, you're going to be holding your baby soon, right? No, she got stuck. This child got stuck. All 9 pounds, 3 ounces of her, and I don't have a lot of hip. Yeah. So the midwives had said, Irena, we're going to need to get your baby out of there. And they literally had to sort of hook her and bring her forth. When my daughter Sonia was born, now see, this is hard because even when I think about it to this day, she wasn't crying. She was breathing, but she just wasn't responding. And the midwives were like, you have to call to your baby. You get your baby to respond. Now, what we didn't know at the time, her heartbeat was strong.
Okay.
But she just, and we all want to see that our babies are okay right then and there. The midwives then said to me, what do you want to do? Now, when you have a home birth, that means you want to transport. You want to go to the hospital.
Okay.
And I said, when she got stuck there, you guys had to kind of pull and tug. Let me check her spine. Let me check her neck. This is a true story.
Wait a minute. You had just given birth.
I did.
And didn't even bring in Dad, who was a chiropractor?
He was, But I was always the one not always. I saw a lot of kids then. So they gave me this baby, and you really almost palpate with just a fingertip and feeling where I thought that tension or misalignment was in that moment. Made the adjustment. You could see the color literally come back into her. And she started crying.
Wow.
It was like, yeah. And the midwife said, what did you do? I was like, I adjusted her. Oh my God. I adjusted her. We took her to a neonatologist the next day, and they're like, "Why are you bringing us this perfectly healthy baby? She came home. She's fine." That is a pretty marked first adjustment. But what happened as a response was the midwife, should they have a difficult birth or a traumatic birth, like a shoulder dystocia, like a palsy, they brought me their infants all under 6 months because they didn't know any chiropractors who would adjust a baby that young. So
just amazing. Oh,
and I've adjusted patients in their triple digits. One of my favorite patients, when she went to a nursing home at 106 for her birthday, was, "Dr. E, could you come get me adjusted?" There's really not a right or a wrong age for a chiropractic adjustment. There may be a right or wrong technique in that moment, but you just can't imagine how thrilling it is to be able to do that kind of work. And I'm sure you feel that too. Like when you see people get well because they've made changes in their life, and that's not your pat on the back. That's a gift that you're allowed to do that. That's the work that you do every day.
Yeah.
Right. What I always say is we are the messengers. Right, we're the hands to dispense it. When you made the comment about there's so much information out there, and people are getting educated, and what he talks about now is how to apply that knowledge, and that's where we as practitioners come into. Like, our role is to teach people how.
Well, there's a lot to digest. I mean, there's a lot of stuff out there.
Right, especially with chiropractic. Now, how often, so let's say one of our viewers says, okay, I'm going to go see a chiropractor. What can they expect? And I know you're going to tell me there's a range, but it's like how often or how frequently or for how long?
If you've never been, let's start.
Let's say I walk into your office and say my neck hurts.
And we've done your history, and we got a little bit of a history there. It's not unusual to see that chiropractor 3 times a week, almost like if you were engaging in physical therapy.
Okay.
Now, not every patient will do that, but I'm working to reset and realign things that have been out of alignment, likely for a while, even if the symptom did not present in that length of time.
Okay.
So, one analogy is, if I had to straighten my teeth out, and I went and I got braces, and it's Monday, I wouldn't go back next Monday and say, am I done yet? It is a process. It's a process to align that hard bony tissue. It's a little bit of a process to align this hard bony tissue.
And it moves slow, and it has memory.
Muscle memory.
Right. So
and some people do amazingly well. But again, I want to evaluate. How are you coming along? How are we doing here? Are you coming through this process a little quicker than I anticipated? Let's start to back off those visits. But by the same token, let's say a condition like stenosis, for example. We treat a lot of people who happen to have stenosis. Stenosis isn't ever going to really go away. It's a process of treating to open up those pathways, to get things to open up. So I might see a stenosis patient more frequently for a slightly longer period of time because it's a long-standing condition.
But you do have, and I think at least from my experience with your business, your practice, I had an initial treatment period that was 3 months, 6 months, 8 months, depending on probably the patient. And then I was kind of set. I kind of went for like once a month for a period of time, and then at one point, Dr. Dan was like, "Okay, come when you feel like you need it."
Yeah.
And so that's what I do now.
It's almost the analogy like I have with the salt room. If you have COPD and you're going to come use the salt room to clear out your respiratory system, you're going to need to come 2 or 3 times a week until we get it cleared out, and then maybe down to 2 times a week, and then maybe down to 1 time a week, or then onto maintenance, depending on how your body responds. So,
and that has so much to do with the patient's goal. Are you only here for get me out of pain, or are you here for, now, I want to make sure that I'm taking care of the spine. We can transplant a lot of things in the human body. Can't transplant a spine. Like, you have to take care of the one you've got.
Yeah, absolutely. And I just remember going through law school. I remember going to my law school, the bar exam, and my muscles were so tight. And we're going to talk about this in a second. My muscles were so tight, he couldn't adjust me. Yeah. He's like, go take your exam and then come back.
Yeah.
Now, how would somebody integrate massage with chiropractic?
That's a great question, and we do have massage therapists on staff. Or should somebody have their own personal therapist? I have no problem with that whatsoever. And again, that's very individualistic because for certain people, they feel very strongly they need that massage before getting adjusted.
Okay.
Others would almost prefer that they utilize massage therapy as a separate therapeutic venue. So perhaps they're seeing me, maybe they see me once a week, for example. That's the phase of care that they are in. But they want to make sure that they get a massage once a week on a different day. Or maybe it's once every couple of 3 weeks. Everybody has their own gauge that way.
For you, though, as the doctor, if you have someone that is getting massages, is it better for them to have the massage before they come to you, or after you, or on a different day?
It's usually better to have it before, except when it's not. When it really is. I'm sorry, that one has no good answer. So
okay, that's why I'm asking.
So that's, let's say,
I'm being a dummy today.
You're a patient of mine,
right?
And sometimes, I'm like, wow, what the heck is going on? Well, I don't know. I just got a massage. Okay, why don't you come and see me next time on a day that you have not had a massage? Like, I want to know.
Where would that complication be?
Well, you have to think about it. You've just had, let's just say you've had a therapeutic massage.
Okay.
Felt great, but at the same time, they've got the lymphatic system activated. They're working out
toxins.
Yeah, and so your body's might be going through a reaction, and perhaps it doesn't want the reaction that happens with an adjustment. And I know that sounds almost foolish, but it's not. I mean,
is it too much of a good thing?
Exactly. Think about
Got it.
Think about how sometimes somebody is sensitive to the cold, for example. And you're like, I love it when it's cold. I want to be out there. I can't wait until we have a cold day. And the next person is, oh no, I got to have on a sweater and I'm going to put my jeans on. I want socks on. So different bodies are sensitive in different ways to everything, whether it's pressure, whether it's touch, whether it's chemistry. You have somebody who says, man, I took that aspirin. It was great. I didn't feel a thing. It's the human body.
Well, you talk about reactions. Before I moved here and before I started with you guys, the chiropractor that I went to, I used to joke with my employees. I was a manager at the phone store. And they would always be like, I'd come in after going to the chiropractor on my way to work, and they'd be like, what did you do? You're very relaxed today. Because I could literally, when they would do the adjustment, I could feel the stress leave my body. I don't notice it as much now that I'm older, but at that point, I could actually feel the stress leaving when I had the adjustment. So I was having that physical feeling of, just from
that's a great
massage,
feeling.
But just the straight adjustment.
Right, and we talk about all different types of health modalities, but when the body's in alignment, the energy is flowing
absolutely
easier, and the fluids are flowing easier, and that oxygen and those nutrients are flowing up to the brain easier.
Well, there's a lot to be said for energy, and while what I do in many senses is mechanical, I take nothing away from the fact that I use my head, my hands, and my heart. And you will feel on a body those changes even before an adjustment. You become more intuitive. Practicing 3.5 decades, there's a lot of times I'm making an adjustment that is an intuitive adjustment as opposed to here's what this particular test is showing me right now. I engage with the essential oils because I know that there is a healing component to that particular level of chemistry. And we have other modalities as well, but I'm kind of touchy-feely when I get in that room. And I've had patients, every now and again, I get somebody comes in, and they're like, I don't really like to be touched. Like, well,
you might not be in the right spot. You guys have a lot of stuff over there. Why don't you give us a quick rundown?
We have, in addition to having 4 great chiropractors, we have 2 massage therapists who are phenomenal. Also within the practice is a whole physical therapy suite, which is under the guidance of the Sarasota Medical Group. So we have a PA on staff, which means that you can have chiropractic care. It can coordinate with your physical therapy as opposed to going someplace else should you need that. You can have primary care. We, of course, have the other therapeutics, ultrasound, cold laser, which is almost a misnomer, but the laser therapy. Electric muscle stim, sort of those normal types of adjuncts to chiropractic care.
Right. Oh, that's just amazing.
Don't you personally do some nutritional counseling?
We do, yeah. And I do, a pretty good bit of nutritional counseling. Dr. Mark likes to do nutritional counseling. He likes to do formulas. He'll put it in his phone, and he's a little more analytical that way.
He's a numbers guy.
He's a little bit of a numbers guy. Yeah,
Right,
yeah.
right. All right, so why don't you go ahead and give everyone your contact information?
Oh, I am Irena Romansky. I've been a chiropractor here for quite some time. I practice at Twin Palms Chiropractic,
And the address?
808 East Venice Avenue. Our phone number is 412-3800. And one of the things about Twin Palms, Dr. Dan and I both, if for any reason you need us, our cell phone numbers, which I won't give you right now, but are always on our answering machine. Like, you can always reach a doctor.
That was going to be my next question, because there's always this thing about the hours that chiropractors are open. Do you have set hours?
We are, I gotta think about that. I think we are Monday through Friday, 8 to 5:30, with the exception of Tuesday afternoons. We just close Tuesday afternoons in the summer.
Oh, for the summer. Okay. But they can always just call you.
Yeah.
There you go. Perfect.
Yeah, there are times, especially during season, that you call, I won't be available, or Dr. Dan will not be available. You can choose to see one of the other chiropractors.
Absolutely.
You could choose to come in and wait and see if we can fit you in, but we can get you in that same day. You may not be able to see me or Dr. Dan, for example, but there will be somebody there to take care
But
of
if
you.
I tweak my neck and if I walk over there, the possibility of somebody being able to help me.
Absolutely.
Well, and I know because I did it one time. You guys have a Facebook page, and you can even make your appointments through Facebook page. You respond pretty quickly. In fact, I made an appointment through Facebook, and then I came in, and then I had scheduled another appointment, and I came in, and I got a reminder from the Facebook appointment.
Oh.
But I had already gone back in, and
Yeah.
I just sent a message back and said, I've
Yeah.
already been there, but yeah, you can do it.
They do. They've got some automated scheduling, and of course you can fill out your whole history before you ever come in there.
Oh, that's a good
So
point.
if you don't like to sit there and fill out paperwork. So we've really worked, because unfortunately in healthcare these days, there's a lot of paperwork, and there's no way to get around it.
Well, but however, when it comes to your chiropractic care, you need to know if someone has had a brain injury,
Oh, absolutely.
if they have any allergies. So, yeah,
There's a lot of input, and for good reason, of course.
right, absolutely, absolutely. Well, I am just really happy you were here.
Oh,
I'm really glad.
Thank you.
I'll be walking down the sidewalk now.
I'm
and-
sitting here thinking, I need to go make an appointment. It's
I
been
know.
too long.
Me too. It's just like, oh, I'm sitting here going,
Yeah, exactly.
I'm sitting here like sitting tall, my neck's going like this.
Yeah, we're like thinking about, as you talk about the places, the things down my back that like, yeah, I need to go.
Talking to you a little bit.
Right. And it doesn't have to be a pain. It doesn't have to be your back. It could be your digestive system. It could be a headache. It could be allergies.
It could be any number of things.
And you won't know unless you ask. And there's, what's there to lose? And it may
Nothing, in my
just,
opinion.
right.
You know,
your
I always
body-
say, unless you don't have a spine, you really. Although I have a brother who claims he's spineless, but
there you go.
the only way to know if you have that misalignment in the spine is to have it checked by a chiropractor.
Right.
That's the bottom line.
And not just that it's a spinal alignment, it's making sure the pathways of the nerves are open and clear and connecting, and the energy is
And that's
flowing.
the purpose of the adjustment,
And
of
that's
the chiropractic
the purpose.
adjustment.
I think people, the misinterpretation of chiropractic is that it's just lining up bones, that they don't understand that that's where the nerves are that connects to the legs and the neuropathy and the digestive system and your respiratory system, and that's where all those nerves are. And if they are out of alignment,
They're not getting the message.
they're not
communicating.
firing.
Mm-hmm.
Right, exactly. That's where the importance is are those nerves along the spine.
Yeah.
This is Beth Annie Stockdale here at your Total Body Wellness Center, right down the sidewalk from Twin Palms Chiropractic, and I'm at 800 East Venice Avenue, Suite C, here in Venice, Florida, 342. What am I doing? 34285.
I'm usually the one that does that.
I know. I went from my zip code into my area code. The zip code is 34285. The phone number is 941-468-7091. You can text me, call me. We do a lot of work together, Twin Palms Chiropractic and myself, between the salt room and the Pilates and the flexibility that I have here, working with them, strengthening muscles, holding alignments. I've been referring back and forth since I opened the doors. So yes, but we had not met before, so I'm really excited about this. I've worked with Dr. Dan for years. But yes, so thank you for being here.
My pleasure.
Suzanne.
I am Suzanne with Discount Med Direct. You can reach me at 941-421-7155. We are in Port Charlotte at 2414 Tamiami Trail, Unit 1. Don't forget to like, subscribe, share our videos, and find us on YouTube for videos. Find us on iHeart or Apple Podcasts or wherever you get your podcasts.
And don't hesitate to reach out in the comment section if you have any questions for Dr. E or one of us here. We can follow up. If you want to learn more about chiropractic, we can go on the road and go over there and do another session.
We're gonna have to put our camera on wheels because they got so much stuff over
We
there.
go on the road. We've gone to other places, and so we can take this show on the road and go over to the chiropractic office. If that's something you're interested in learning about, just leave us a comment, because our deal is we want you to be well, feel well, and stay well.